Now to the latest on COVID. For the third straight day, new infections nationwide topped 800,000 as Omicron's bullseye heads west. CBS's Lilia Luciano has more now in Los Angeles. Lilia, good evening.
Good evening to you, Nancy. Well, the surge of Omicron doesn't seem to be letting up anytime soon, at least not here in California. The number of COVID deaths in Los Angeles County hasn't been this high since April.
Omicron is straining America's hospitals, with more than 21,000 COVID patients admitted every day.
They are overwhelmed right now in Kansas City. Really, since the Christmas season, we have seen incredible challenges.
Almost every American lives in a high-risk area. Florida just became the third state behind California and Texas to pass 5 million total cases. And a disturbing trend, catching Omicron on purpose.
What do you tell people who say, I'm just going to get infected and get it over with?
It's a lot like playing with fire because we don't have a crystal ball that's going to tell us who's going to get a mild infection and who's going to get a more severe infection.
Dr. Nicole Van Groningen of Cedars-Sinai.
Have we seen that long COVID is a risk with Omicron?
It's this lingering symptoms, cough, shortness of breath, fatigue. It's reasonable to assume that some percentage of people who get Omicron are going to develop these long COVID symptoms.
With a 47% case drop, New York's Omicron surge has eased, but a spike of violence in the subway has become a horrifying emblem of a city in disarray. On Saturday, a woman was shoved to her death on the Times Square subway tracks. Police say the suspect had a history of mental illness.
This is unconscionable. This is unacceptable. It has to stop.
While Omicron's grip has loosened in the Northeast, according to the U.S. Surgeon General, it could be weeks before we see new infections peak across the country. Nancy.
Lilia Luciano, thank you.